you. So yes, as Megan said, I'm going to be talking broadly about the social benefits of gameplay for older adults with and without mild cognitive impairment. I am a researcher at the Georgia Institute of Technology. Our group is called the Center for Inclusive Design and Innovation. And I have the privilege of working with a really strong interdisciplinary team with expertise in a lot of different areas, including mild cognitive impairment, online gaming, clinical research, technology design. So working with the Cognitive Empowerment Program has been, a perfect fit, and we're really appreciative. We've gotten to do several studies with you all, and I hope to tell you about some of those findings today and some of our future work. So let me continue here. So just first a little bit about me again. So I'm a research scientist at Georgia Tech, like I said, and I get to work on a lot of different kinds of projects. Broadly, they're all focused on how do we design technology for people who are aging. A lot of my work focuses on those who are aging with impairments or disabilities. We talk a lot at our group about universal design, so designing things that can work for everyone and focusing on what the user's needs are to drive how we develop that technology. And I think that user piece is very important because that's a lot of what our work has been with all of you. We want to co-design or test with our users. So we've done a lot of research with people with cognitive impairment, people with MCI, and their care partners together. And we work together to find something that is best going to meet the needs of those who we're designing for. So we'll talk about that more a little bit later. But that's been a big part of our approach. Um, I have a background in psychology, and I have many years of clinical and research background. Before this, I actually worked at a memory center at the University of Pennsylvania and got to do some of the cognitive assessments. And some of the neuroimaging work. So it's really fun to get to, have been in all different angles of healthcare and research. So before I move on, I would be interested, Megan, if you could potentially look in the chat if we have any game enthusiasts here. Do we have people who like playing games? And if so, what kinds of games do people like to play? Um, And oh wait, I might actually be able to see the chat. I can actually on my other screen. So apologies if I'm looking over here. I have multiple screens. Thank you, Megan, for reposting. Oh, good. I'm seeing some come in. Wordle, connections. Oh, the New York Times games. Those are something that I've recently been playing more. Card games, video games, checkers. Wonderful. Phone games, board games, puzzles, and word games on the tablet. One thing that I really love about my work that I've gotten to do with you all is that I've learned about a lot of new games. Actually, Rummy Cube, for example, is one that a few people has said that they really liked, and I now got my parents hooked on it, and it's been really fun because we don't live in the same city anymore, but we get to play that using an app, and it's been so fun. And I miss them so much in a way to connect. And that's kind of a lot of what sort of inspires some of the work that we do. Let me see a few more. Oh, adult coloring books. That's great. I don't even know some of these. Oh, great. Rummy Cube. I see we have fans. Word search. These are great. I love Kitty Letter. See, I've never even heard of that one. I'm always learning more games. Um, and what's interesting about the games that you listed, it is such a great variety of games here. what I'm seeing is that some of these games are more physical game pieces, like checkers where you have a board and pieces that you're moving. And I'm also seeing digital games as well, ones you might use on your phone or tablet. Um, and that's a really good assortment because that's kind of some of the things we were interested in. What kinds of games are people playing? Are they used to digital games or not? And we looked at all those things. So great. Thank you all for sharing. And again, I encourage you to keep using the chat. But I'm glad we have some game enthusiasts here. Um, we what before I sort of talk about sort of what game kicked off this study for us, what I'll say is that a lot of the work that I've initially was familiar with in terms of games and mild cognitive impairment is talking about the cognitive benefits that games can provide. And while that's certainly interesting and important work, um, what's often not discussed as much are the social benefits that games provide. Um, yes, there are a lot of, potential benefits or interventions focused on cognitive exercise and brain training. Um, but our work is on the therapeutic benefits of social interaction you could get while playing a game, how that could lead to improvements in bonding and quality of life. And that really is how we connected with, the vision and goals of the cognitive empowerment program. So let me continue. Oh, I'm sorry. I heard that is that better, everyone? Thank you I'm seeing that it was superimposed. How's that? Is that a little bit? Oh, there's a black screen now. Oh, you know what? I'm sorry. I think I know what the issue is. How is that, everyone? Is that looking better?
That's it. Yes. Thank
Thank
you.
you so much. I appreciate your feedback. Don't want to cover the screen. That's not going to help anyone. Thank you all. Okay, so let's talk about an initial case study, what actually sparked this project, which has now blossomed into several projects. So one of my colleagues who actually developed this initial project, she was working with someone and said was they were talking about how they have family members who enjoy playing Scrabble together. I think we had Scrabble as maybe I'm looking back. I might have seen Scrabble as one of the games, or at least now there are so many versions of Scrabble, um, online versions of word-based games. But but these two, I think it was an aunt and a niece, loved playing Scrabble together, and they didn't live in the same time zone. And so they would use a mobile version or an app, a digital game to play Scrabble in different time zones. And when one of them developed mild cognitive impairment, they noticed that playing the game together was more challenging. The individual from MCI would make shorter words. They wouldn't score as many points as they once did, and the game just became less enjoyable for them. They lost interest in playing the game. And we found that many couples and families are, seeking opportunities to stay active physically and mentally, and they want to support their brain health. So we really, took this as an opportunity to use games as a way to try to sort of find ways to make playing games something that could still be enjoyable for individuals with mild cognitive impairment and their families to play together? How can we redesign them so that they could continue being played? Let's go to the next slide here. Oops. Okay, so uh, let's talk a little bit about social interaction through games. So we know that individuals with mild cognitive impairment, they have some unique challenges feeling socially connected. So in the previous example, we talked about how, how in this one example that the person with MCI playing the game didn't feel as interested in playing, wasn't enjoying it as much. And, so likely that led to them really not playing and connecting anymore. Um, some of these unique challenges that can come for people with mild cognitive impairment is they um, they may have progression of some cognitive symptoms that could limit opportunities for meaningful social interaction. It could be difficult to maintain social networks, and they could, may withdraw and have more social isolation because they're finding certain things they used to do to be more challenging and frustrating. Um, this could be due to, changes in some of their abilities, and also less opportunities maybe to physically be together, um, having difficulty physically, getting to be in the same space with one another. Um, so both of these can create a lot of difficulty playing games with each other, and social interaction is such an important part of your health and quality of life. Um, and what was I going to say? Games offer just a wonderful opportunity for people of all ages to really come together and socialize and um, do an activity together that is fun. Um, Let me just move on here. The good news is, though, that digital games, like the example we had before with Scrabble, can provide an opportunity for people to keep playing together to overcome some of these barriers. Um, but there still is a lot of room for improvement. The technology may not be designed for older adults or people with mild cognitive impairment. And they may not necessarily facilitate a good interaction with as much as being in person next to each other, like these two people are in the picture playing right next to each other. It may be harder for people who aren't together to feel like they're really playing and having a fun experience together. So that was our challenge. We really want to work on developing an adaptive, accessible experience for people to play together so we could keep getting all those wonderful social benefits. Um, you know, and just having that great pastime of getting to play together. So that initial idea of let's develop a Scrabble game that people can play together. Let's create an adaptive version of a well-known game like Scrabble for people with MCA and their family members to play together. That led to our first study. We were the among the initial recipients of a seed grant program through the Cognitive Empowerment Program. So the 2020 grant recipients, and I got to work with some of the first cohorts as part of the Cognitive Empowerment Program, which was wonderful. So our project was called Development and Testing of a Social Game with the Therapeutic Potential for Individuals with MCI and Their Families. Um, this was at a very interesting time where we were able to be in person, I think, for 1 or 2 months before the pandemic shut us down. So we really had to then move everything online. But we still got a lot of really good data. At this point, the first part of this study was really doing a lot of interviews with people with MCI and their care partners to really first have that initial understanding of what their interests are, what kinds of games they're playing, what their likes and dislikes were. Um, and then sort of testing some games in the second phase of that study. I'll get into a little bit more detail about the specifics, but that was where it all started. And what's exciting is that work then um, propelled us to have an industry partnership with an online platform called oneclick.chat. That's the screen on the right. Similar to Zoom, it's an online social engagement platform, a video conferencing platform, but it's specifically designed to be easier to use for older adults. And they've partnered with us to help develop online game experiences. Um, and we now have funding from the National Institutes on Aging, and we're doing more work creating digital games and prototypes. Um, and on the left, you have a version that we created similar to Scrabble, and just someone doing that version with kind of a modification that we put in. So I'll get into some examples of some of this work, but just it's just really exciting to be able to zoom out a little bit and see how much a small idea turned into so much research. Again, thanks to you all. Can't see the one on the right clearly. Can you repeat the page? I'm wondering if oh, I'm sorry. Sorry, I saw a comment. I want to see if there's anything I can do to potentially make that bigger. I'm not sure, but you know what? I think that we have the slides available that we could send afterwards. Let's see. So let's talk about some of our initial findings from that very first seed grant study. So that was a small study we did with 7 dyads. When I say dyads, I mean an individual with MCI and their care partner. So we would interview both of them together about their opinions and their experiences playing games. These were structured interviews that we would complete, and we had a long list of questions about memories playing games, what they currently play, what they used to play, preferences in terms of speed, the number of people they like to play, what challenges they've run into, things like that. And so we got some really interesting initial results. So of this group, short games were preferred. People like fast and simple games. Generally, they want to play with no more than 2 to 4 people total. We heard a lot about how big group games can become overwhelming or overstimulating for some individuals. Most people did play games, although a lot of times people said that they didn't necessarily play together. And we'll get into some of the barriers about why that was. Um, but often people would either play with other friends or they would play by themselves. And that was a big part. And, what we're trying to work on is bringing people together. Maybe the care partner would play with friends somewhere else, but you know, the member wouldn't necessarily have that social connection. Um, so both people enjoy strategy, and we did have some really competitive people in our group. It was fun to see people get really into detail about how they really like to score points. But overall, we learned that not everyone said that winning is always the goal. While winning is fun, it was more about wanting to feel engaged in the game, feel like they're succeeding and getting to, you know, to be part of the game. And so I just included some other likes and dislikes here. Games brought up a lot of laughter, good memories, companionship. They were a big way to relax and a challenge for people. Some of the dislikes or barriers that people ran into with game playing is that they were too long. I mentioned too many players. Some of them required too many demands of memory or multitasking. Um, and while people really like strategy, that could be a really fun part of the game. Sometimes it was a little bit too much uh, complexity. And so just being mindful of that. And then in our second study, then we went and we observed our dyads playing games, and then we had them discuss their experiences after. So we would watch them play games and then have the questions that we would ask. They would play both physical and digital games, and some of those games were prototypes, like the one I showed on the previous slide, that word game, for example. We also did crossword puzzle-like games, code names, if anyone's familiar with that, and let me think. Yeah, some word-based games. And they did up to 3 sessions, and we had 6 pairs do that. So this work I've continued to get to present at conferences. On the left, I got to present at a big conference, the Gerontological Society of America, a poster that I'll share some results about. But yes, I think that that's the largest aging conference, I believe. And so it was great to be able to share some of the feedback from those interview sessions and share our work. And then on the right, I am with my colleague, Kayla Jordan, who also has been involved with the Cognitive Empowerment Program. I don't know if any of you all are familiar with her, but both of us were just in Lisbon, Portugal. I just got back, oh my goodness, on Sunday. So apologies if I'm a little jet lagged. But that was an amazing experience to go to. It was a conference on games. So I was with a bunch of game developers and getting to share again more work that we've done with you all. So I just really want to extend our thanks and gratitude. It's exciting that our work together is now being shown to an international audience. And hopefully we can keep moving forward. Um, so a little bit about what I shared at GSA, or the Gerontological Society of America. This was from that first study, again, that interview study. We shared perceived social and emotional benefits of playing games. So again, we went deeper into some of the interview data, and we coded all of the transcripts. And I did this with another partner. And the two of us made a coding scheme and reviewed them and pulled out themes that we saw that came up from all of the data. So at a deeper level. And so we saw, again, benefits that came up repeatedly was that camaraderie and companionship that people feel, joyous interactions, and the memories that people develop while they're playing games. They felt that it was a safe space for them to feel like they could grow and understand. So a lot of people talked about how like they have learning experiences during games, which was really interesting. Um, it was seen as an intergenerational tradition or activity done with families. And again, as a meaningful or relaxing pastime, a lot of people talked about maybe after dinner or before bed, that games were a really nice way to unwind at the end of the day. And then getting a little bit more in depth with some of our limitations. Again, some of the overstimulation or difficult focusing with some of the games out there. People were afraid of playing games because they didn't want to feel singled out. And or they felt like they had a lack of opportunity playing games. They didn't really have anyone to play with, or felt like they didn't, know who they could play with, who would want to play with them. Some of the negative experience also were people who were too competitive, who were only interested in winning, and very cutthroat players. Or just changing times. Some people talked about how they would play a lot with their grandchildren or other family members, and then that they moved, or their children, went away or had different interests. And so that, while they may have been gamers for a while before, they were playing less games in the present time. And then this is a quick picture from outside the Technology Innovation Center in Lisbon, where I just presented. This was the bulk of our presentation now was in our our current study. This is hot off the presses, our fresh new work about what we're currently doing now, which is moving games now to an online environment. So this project now was how do we develop a measure that we can use to see if online games are good at feelings of creating feelings of being with each other, feeling social interaction, feeling engaged while you're playing online games. And so I'll go through some of this a little bit high level because some of these were a little bit dense for slides. But basically, we know that technology provides opportunities for people to connect with each other. And our work now, this current stage of our project is focusing on developing an online game to support social engagement. So we wanted to capture short-term, immediate interactions of people playing games together. And so we did a literature review. We looked at journals across journals in related areas of study to look for what's already been done to look at social interaction and engagement with games. And we really didn't find anything that we were looking for. We were looking for when we say co-presence, we mean a feeling of being present together in the moment, even though you're not in the same space, and socially engaged, you know, having meaningful connections with other people. But we didn't find anything, any kind of questionnaire or assessment that we could do to help us measure if the games that we were creating really helped facilitate that social connection. Um, And so we didn't find anything. And so we created something. So that's what I was presenting in Portugal. We created we call it the co-presence, social interaction, and engagement, or SIPSE is what our cute little name for it is. Our SIPSE measure. And it's a 20 item self-report measure. So I'm sure through the cognitive empowerment program, you all have had to fill out a lot of paperwork and do a lot of questionnaires. This one is 20 items, and basically we ask people to rate their experiences playing a game on a 7-point scale. So it's from strongly disagree to strongly agree. Um, and we look at different areas, and I can pull up more later, but we look at sort of if they're able to attend or pay attention to their partner, if they felt like they were able to emotionally understand what their partner was feeling, if they had positive experiences, um, and if they felt connected or aware of what their partner was feeling, for example. So these are just a few of the questions we had, like I remained focused on my partner. My actions were in response to my partner's. I could tell what my partner was feeling. I felt tense or uncomfortable. Our interactions were fun. I felt connected, and I would play this game again. So I know we're running a little bit shorter on time we'll go through, but this is what it would look like if you were filling it out yourself. Um, and so we had people play games. We adapted well-known, enjoyable games to test on our online platform, One Click. Um, and so Uno, Connect Four, and Codenames were the three games that we tested. So we had online versions of Connect Four, and Codenames is a game where you are trying to have your partner guess guess some cards that are hidden to them based on some clues that you give them. And Uno, we actually had players using physical cards, and then we created a version with digital cards. But the work I presented was focused on Connect Four. So for those who aren't familiar with it, that's where you are dropping tiles into a grid, and you're trying to line up four in a row. That could be diagonally, horizontally, vertically. And we tested two versions of Connect Four. So one was at the top, where this was a free online version that we found, very simple, stripped down version. And then below was a redesigned version on one click that we integrated into their platform. And there were some adjustments that were made. We had greater contrast. Um, and helped you understand where you would be dropping your tile. We added noises for it. There was more instructional support. We would give more feedback, whose turn it was, player names, who won, things like that. So we had adapted versions of these games based on what we learned about what supports would be beneficial for people. Um, and I won't get too in the weeds with the data, but basically we had people do the assessment, the SIPSI, before and after playing different versions of the game. So study one was the more simple, free version of the game, and study two was with our new and improved Connect 4 version. And we found that with our new and improved version in study two, that there was a difference. Let me see. The difference between in-person and remote scores decreased significantly, meaning that people perceived both in-person and remote playing of those games to be very similar. So we were able to make, whether they were playing together in the same room or they were playing together in different rooms, those experiences became more similar, meaning that we were able to create a greater feeling of feeling connected, even if you're not playing together. Um, I think I need to wrap up soon. So I just wanted to say that we have future work coming up. So we are very soon, I think we're in an early recruitment process. We should hopefully start screening our first participants soon for a randomized control trial. So this is a much bigger a much bigger experiment that we're going to be running that's going to test more of these game experiences on this online platform, oneclick.chat. We want to test whether the enhancements we made transfer to social connectedness for older adults with and without mild cognitive impairment. I see a question in here. There is not a fee to play on the One Click site. And in terms of people who want to play these games, that's a great segue because my colleague Balaji, I think, is going to hop on in a moment and tell you a little bit about opportunities. Again, we're recruiting, and so potentially some of you in the audience may be interested in seeing if they want to take part in our study and getting to play some of these games. So my information is here. I think Megan can share the slides, but I'm going to pass off to Balaji since I apologize. I think we're almost at time. Oh, wonderful. I see someone in the chat. Thank you so much for your participation. Let me, Balaji, I don't know. Let me end my screen share.